Thank you for being present here. And it's a postprandial session. We all know we are all so sleepy after lunch. But I hope to instigate you to think about what I am talking. This is not going to be exactly a teaching session. This is more of what, as a healthcare delivery partner for the corporate or for the industry who face occupational hazards, what can we do as healthcare partners for you is what I am talking about. The presentation is not very elaborate, just a bit of talking about what exactly the hazards are and how we can come in and help you all. So we all know that occupational hazards are of 5 types that we divide them into: biological hazards, the chemical hazards, the physical hazards, the ergonomic hazards, and the psychosocial hazards. We all face it. If most of you are doctors and physiotherapists who are attending these sessions, we all know we all have ergonomic hazards. Sitting on the table, doing table work gives us many musculoskeletal disorders. And nowadays, in healthcare delivery, we are focusing on these hazards. So a lot of us are sitting in front of the computers. We face these blue light issues. So ophthalmology is actually focusing on these issues as well. Of course, in the industries where we have these physical hazards like high heats or air quality or as in radiation, radiation is present everywhere, and we know of this one incident which happened in Mayapuri in Delhi, where a radiation emitting source was just thrown away because it was sold in the scrap and nobody knew about it, and so many patients suffered because of that. They didn't know what it was. So now the radiation safety has become such an important aspect, and AERB has become very conscious of the fact that how do we dispose of our radiation sources, because many industries are using these radiation sources. Not only healthcare industry, which uses these sources to deliver radiotherapies. And of course, we are aware of the chemical hazards in chemical industries. So WAPI is a place where there are a lot of chemical industries, and all the time chemical hazards come into forefront, wherein they are using chemicals to create blasts and create all these insecticides and all. And they create blasts, and are they protecting the workers enough from these things? Then we have these biological hazards. We all know people working in industries, chemical industries, in quality industries are exposed to bacteria, viruses, and parasites. There are inhalational biological hazards. We also went through that when we were going through the pandemic, right? We all were exposed to this hazard. And psychosocial, yes. Many a times you are given deadlines. You need to follow those deadlines, and it creates a lot of stress. We all undergo a lot of stress. So these are the hazards. You know, these are hazards which are divided into 5, but we all face them. Probably all of us hit us in any which ways. If you are living in Delhi, we all know having an occupation in Delhi exposes us to air pollution. It's such a severe pollution. The air in Delhi is severely polluted. We all face it, and these are the times when it is the most, when they are burning those leftovers from the fields, and it's all occurring as smog. So how to deal with them? So we all know that Organization for Labor, or International Labor Organization, developed that how to manage the occupational hazards. You all are aware of it. You must be practicing in your industries wherever you are. You know, first is, do you have policies to manage these hazards? Are the policies in place in line with the guidelines? So we as doctors will be exposed to these patients or these employees who come to you for advice that what is to be done. Then what is your role sitting there in that organization to ensure that whether the policies are in place to safeguard the workers, the employees working in a place where occupational hazards are common. And while those policies are being placed, have we taken the workers' union or people who represent the workers being part of that policy, and while we implement them? It's not about just saying this is what the policy is and we want to implement, because there may be certain areas, niche areas, which are experienced by the workers, that this is a problem that we are having which is not underlined in the policy. Can I come and talk to you, and can we incorporate it into the policy? So worker participation to create a policy is so important. Who will be responsible? Who will be accountable if there is an occupational hazard? So we as doctors also need to find this. Who is responsible? You know, a patient comes to you, you treat him and that's it? No, it is not where it finishes, because it can spiral into many patients coming to you for advice. So who is accountable? Who is responsible? Do we have enough competence? Do we have training instituted in the place so that workers know that these are imminent hazards which they have to go away from? Is there enough documentation on the safety and health of the workers? I'm sorry. Are we jotting down everything? I'm sorry. I have it. Thank you. Thank you, Dr. Gupta. Is there enough documentation on the hazards? Are we putting down everything? Is it being communicated that these are the problems that are being seen? And are we recognizing that the policies probably are not enough? They need to be reevaluated and redone, reviewed and redone. Have we planned to review all the methodologies and measures that we have taken? Are they enough to help the workers or not? Are the systems in place? Are we developing and implementing right things or not? Are we following all the guidelines established for occupational safety and health of workers? Are we doing enough preventive measures or not? So this also becomes our prerogative as industrial medical doctors who are there in that organization. Also, are we, whenever an incident happens or is registered, first, is there a mechanism to register an incident? Are we investigating, going to the root cause of the investigation, and putting in place the corrective and preventive actions? That is important. That is what completes the whole loop. So we as medical doctors should also get into that. So we have to be part of policy making, implementation, auditing, monitoring, and supervision. That is how it goes. If you are not auditing a system, if you are not monitoring a system, if you are not supervising a system, no policy, no implementation will ever work. You still will have all those problems. So this is how you would kind of manage occupational hazards. Now, there are many methods of controlling occupational hazards. There are 5 levels, as we call. The best is to eliminate hazard. But we all know, all the times, elimination of the hazard is not possible. So, if you are using ink for printing, so you cannot eliminate the ink, because for printing, ink is required. Now this ink is a solvent-based ink, which is not good for you. So what do? So you substitute. So now we have started using plant-based dyes. Okay? So if elimination is not possible, you do substitution. And when we talk of elimination and substitution, these 2 elements are important while you are actually working on how the workplace will be formed, what will be the process flow, how is it going to flow. How can you control? The next level would be, can I control the exposure to the hazard? The hazard is there, but can I create a barrier between the hazard and the worker so that the hazard doesn't reach the worker? So that is done by engineering, architecturing, so that you make screens, have areas where the hazard will not reach you, and you're working there. And now coming to how can you administratively control hazards? So are you actually looking at, suppose, say I am on a rotation duty. in a industry where it has evening hours, it has morning hours, and sometimes night duties also. Is just one person doing every time night duties? So can I do a rotational duty? Can I give them some off? So wherever radiations are used, and they of course have a TLD badge to measure the radiations, but they also give them time off. When the measures are going off high in the TLD badge, they will say, okay, you take a time off. That's an administrative measure. There is no work hours lost. Some other would be present there to take over that task, but the worker needs to be taken away. So you will have to look after that as well. And of course, the least protective of the control of hazardous personal protective equipment. We all have used it during COVID times. You know, you all were wrapped in the hospitals, but in spite of PPEs, hospital doctors, nurses, you all who were going in your workplaces were exposed to COVID. And we all suffered in spite of wearing masks, double masks, gloves, still we had. We can control, but the most effective method is elimination, which is always not possible. If I am working in a bank where public will step in, they will come in, I cannot check everyone from not having COVID and giving it to me. It will happen. So elimination many times doesn't work, is the least effective actually. It's the most effective, but we are not least implemented. We cannot implement it. The least effective is PPE, but that is what we saw was most implemented because of ease of availability and the high exposure that we were done. So how do I manage occupational hazard so that it doesn't reach the worker, it doesn't affect the worker? So two ways, we all know about it. Either we go the preventive way and control the hazard, or we have therapeutic solutions for the hazard management. We are all aware. So what is important for prevention is we do a pre-medical checkup. So you are taking somebody into an industry which has loud noise, okay? You give them earplugs and everything. In spite of that, they may go deaf. So what do? You do a deafness check on them. And you find out that if somebody is already suffering, you advise that this is what can be done. So your preventive medical checkups are so important. And if as an industry, you come to us for a preventive medical checkup and tell us that these are the occupational hazard in your industry that you look at, then we can help you identify who will be a vulnerable employee. You can tell us, we will tell you that this can be a vulnerable employee. Of course, with our engagement, you can create health education and awareness on the occupational hazards. We can do periodical examination for you, on-site, off-site, whichever way you want. We can screen your patient. If I know this is the commonest hazard that happens, we can do a screening as and when required. If you have in your policy that we will do quarterly screening, we can help you do that. And of course, you can ask us to do regular workplace audits. You yourself are doing audits. We can also help you in terms of health. Are you there or not? Are you following your policies or not? And how would you control so that whenever we are doing these audits and checking on whether your policies are implemented or not, we can control the newer people being affected or newer hazards cropping up. We can identify them. And of course, personal protective gear is always recommended wherever you are very close to the hazards. So what is in it for you? I don't know whether you are aware of this or not. I wanted to bring it to your light that the Government of India recognizes the importance of preventive health and has granted a tax benefit under Section 80D of income tax for any expenses incurred for preventive health program. I don't know whether you all are aware of it or not. We can recommend it to our employees, though you have a corporate policy of doing preventive health check, but if they want to, they can go ahead and do some more preventive checks which may not be included in their corporate checkup list. If you you can avail rupees 5,000 for the cost incurred for preventive health checkups for self, spouse, children or parents. And also, in case you pay for the preventive health checkups of your parents who are 60 years of above, you are eligible to avail rupees 7,000 as the tax deduction under Section 80D of Income Tax Act 1961. So I'm sure this knowledge will help you. So now coming to what would be the approach to manage these kinds of occupational hazard, and how can I help you? Early diagnostic and holistic treatment planning is the way forward. Notifying the concerned authorities, whoever is responsible, as I told you, how do you manage? You have to assign responsibilities and accountabilities, and educations on signs and symptoms of occupational hazards and concerned areas. Please call us, we will help you do that. Educate your staff on it. And of course, once you have a tie-up with us, with any healthcare delivery organization, the employee or the worker knows where to go to access healthcare as and when required. Sorry. All right. Plus, the doctors definitely are going to advise how to continue care. Substitution for work hours lost. You know, when a patient is suffering from occupational hazard, work hours are lost. So administratively, somebody needs to work for those hours, and we will recommend to the company that yes, he needs this bit of rest. So that's our thing, and he will recover. We form support groups for such patients who can come, who can talk, and rehabilitation in such cases is very important. And also awareness on when can they resume work. It's so important. You know, you feel that everything is lost. A worker, when is exposed to an occupational hazard and he's working in that occupation, he's always thinking of changing his occupation because he cannot avoid the hazard. So we can support him through a support group. We will rehabilitate. It's not only about physiological rehabilitation. It's not about physiotherapy. I'm talking of psychosocial rehabilitation as well. And creating awareness that all is not lost, you can still manage. So to sum it, it becomes to recognize the presence and existence of hazard, to assess the potential risk of the hazard, how long, how far can it go, to control the hazard and exposure, and finally, to evaluate the solutions that have been put into place, are they really effective or not. So what is the role of Apollo in recognizing occupational hazards? So we will help you formulate employee-friendly health policies. If you want that, please call us, we will help do that. We work hand in hand with the corporates and arrive at a solution which is acceptable to them. And definitely preventive health checks with focus on occupational hazards can help you all. So what we call in preventive health check, we call it Pro Health. You are all aware probably, this is an app which is there where you can book your appointments, create health risk assessment, call us for home sample collections. We will send you a medical report wherein we have senior doctors looking at you. It's not about just one physician, it's about a cardiologist, a surgeon, an ENT specialist, an ophthalmologist. So we can cover all your hazards. Please reach out to us. So early diagnosis, CMEs, and awareness sessions, please reach out to us. We give you the right treatment and rehabilitation opportunities. So predict your risk, prevent your health issues that may happen, and overcome whatever disease that you have and rehabilitate yourself. So early detection, timely intervention, and adherence to monitoring. To end this, I want to say that we are doing an international patient safety conference on 13th to 14th February at Taj Palace. We are expecting 2,000 plus delegates and around 200 speakers, national and international. Please join us. This is the 9th in the series. You will definitely be having a learning experience of your lifetime. So happy learning to all of you. Thank you so much.